Welcome to ROI's Couch Conversations. I am your host, Shelly Ann Jackson. Jeff Tennant, our Executive Director of Revenue Cycle Services, joins us today to help us understand the big picture behind regulations and its impact on healthcare organizations. What are some of the biggest challenges hospitals face today with regulation?
Regulatory issues, they've been a constant companion for the hospital and healthcare CIO in the last 10 years, maybe a little more than that. I know as I've traveled around the country and worked with CIOs, there's a lot of angst with CIOs that they spend the great portion of their budget now keeping up with regulatory changes. Back when I was a CIO, we had that at a certain level, but I think, we were in a better position. We were able to do more things that were helping to improve the patient experience, things that were helping to improve our organization's ability to take care of patients. And now I think CIOs feel like they spend 75% or more of their budget just keeping up with the federal government and the changes that are being required. We saw a huge push during ICD-10, now we're talking 10 years ago or almost 10 years ago now. And it helped organizations focus on the EHRs they had in place and how information flowed through the system. There was a lot of work done by a lot of organizations to enhance their coding staff's knowledge and ability to improve their physicians' ability to do a better job of documenting procedures based on the new specificity under ICD-10. But a lot of organizations did a lot of work in the electronic health record side of things and didn't focus as much on the financial impact of ICD-10. When I was working with organizations on their ICD-10 strategy, those that we worked with that were what I would call early adopters, even prior to the transition to ICD-10, they were seeing improvements in their bottom line based on the improved and increased documentation. In today's world, as we look at MACRA and the MIPS approach to MACRA, we're now entering or we're into the penalty phase of that initiative being 2019. And I would ask you to look at your organization. How have you addressed MACRA and how are you going to fare this year from a Medicare reimbursement perspective, right? Are you seeing an improvement and an increase in your payments? Are you dealing with penalties? Where are you in that journey? And, again, that was another area that organizations had to decide, was the spend in order to be compliant and do the things that needed to be done worth what the penalty was going to cost them. And, as we look at the increase, year over year increase in the penalty, as well as the year over year increase in the potential for improvement, at what point is your organization in that journey, and where are you in maximizing your reimbursement from a Medicare perspective based on those initiatives? This, MACRA was put in place to get away from the meaningful use stage 3 initiatives related to physicians. There are a lot of things in MACRA that are based on quality measures that both either incentivize or penalize organizations for meeting those quality metrics. As we look at how do we navigate these waters, again, you have to, from an organizational level, determine what makes sense from a cost perspective. So what is the cost of doing something compared to the cost of doing nothing? And it becomes more and more difficult to determine where that tipping point is for your organization. As we talked about a moment ago, we look at the change in the penalties. We look at where the penalties, start and then where they can go to. What year is it most beneficial for your organization to be ready and compliant with all of the requirements of MACRA? So that's another area, doing an assessment of looking at, where your organization is, how you're reporting on the MACRA measures today, and seeing where you have potential for improvement, and maybe become one of those organizations that instead of taking the penalty is now receiving the benefit of doing a better job. So all these areas are potential opportunities. One of the things that I typically see with organizations and all these regulatory changes that are happening, those organizations that do a good job early on, those early adopters, tend to be the ones who financially benefit from the changes that are out there. We all know that CMS, they do their best to make sure we're taking care of our patients. They do their best to make sure that they are being good stewards of the federal funds that are being provided. But the better we do at making those changes early and maybe exploiting the small holes in the system, the better off our organization is going to do financially. I don't mean that from a negative perspective, but those who get involved and really take these initiatives on do not treat them as a check the box initiative, but actually look at them and try to do the most they can with what they have available to them and really exploit the benefits of these programs early on. They have an opportunity to financially improve their bottom line. For those organizations that wait and try to be later adopters, some of those areas that allow or were put in there that have a loophole or some form of financial benefit for organizations, some of those will be closed up, and the opportunity for additional bottom line is going to be less. So these are all areas that we look at. Most of these regulations come down from the federal government, all related to CMS. But as we all know, as CMS makes adoptions and makes changes to their reimbursement model, many of the private payers tend to follow suit, at least in some way, shape, or form. It's very important to understand your current state, where you're at in the journey, where you've decided that the proposed penalty is not worth the cost of the improvement. But you really need to take a look at that and see what the reality is, because at some point that's going to tip and you're going to have to make that change. So why not be an early adopter and get it done?
Jeff, thank you so much for spending time with us. Thanks for watching.